Okay, we're live. All yours.
You're good, Brent.
Very good. Welcome to the meeting for the Financial Stimulus Review Team. Group is looking at funding requests for social service and public health agencies for CARES Act dollars that have been allocated by Sedgwick County to those purposes. We're switching this morning to Zoom meetings from WebEx, which will allow these meetings to be broadcast and live streamed on YouTube and on Facebook. And in keeping with the transparency of this process, these weekly meetings will be made available to the public, and we will be accepting public comment in a different manner. But first of all, the agenda for these meetings will be posted on social media once it's been developed. That'll typically be on Tuesday prior to the meeting. Sedgwick County puts out a weekly public meeting notice of all the advisory groups, and those advisory groups, this will be included in that weekly public meetings notice that will go out on Mondays. We will facilitate accepting public comments via Sedgwick Cares at sedgwick.gov. So public comment can be made in writing, and we'll read it into the record at these meetings. So we're doing everything we can to facilitate an open, transparent process as we allocate CARES dollars that were entrusted to the county in these allocations for the public health and social service agencies. So with that, welcome to all of the members of the Stimulus Review Team. Aaron, if you want to take roll call, then we'll get into our agenda.
All right. Dr. Walker, are you here with us? Jane, are you here?
I see Jane.
I see Jane as well.
Unmute. Yes, I'm here.
Thank you. Melody is here with us in the room.
Yes, I am. Live.
Thank you. Mark?
Yes, sir. Present.
Thank you. Kyle? I see you, Kyle. He's with us here in spirit, anyway. I'll come back to him. Hope, are you here?
Here.
Lindsay? Again, I see you, Lindsay. We'll come back around. Kevin?
I'm here.
Thank you. And Brent.
Here.
Okay.
I'm here. Can you hear me?
Yes, Kyle, thank you. So it looks like Dr. Walker has yet to join us, but if she does, I'll make sure that gets into the record. And we have a voting quorum, so we can continue.
Okay, everyone has received the minutes from the meeting of August 13th. Are there any additions or alterations to those minutes? And if not, I would accept a motion to approve.
I move we approve the minutes.
I'll second that.
It's been moved and seconded to approve the minutes of the Stimulus Review Team meeting of August 13th, 2020. All in favor say aye.
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 Aye. Opposed, same sign.
And do it.
Seeing
That
none?
passes unanimously. Let's take a quick minute for a technology lesson on Zoom. And it's a way for us to vote. If you, at the bottom of your screen, you should see a couple of icons that look like people that says participants. If you click on that, it will open on the right-hand side of your screen an area so that you can see all of the folks that are on the meeting. And at the bottom, there is a button that says raise hand. So that's another way to vote on a motion, is to raise your hand. So you can click on that. The host will be able to tell if you have, as well as anybody that's got that open, you can see if someone has raised their hand. It'll show up next to their name. Does everybody see that?
Yes.
Okay. In terms of new business, I want to bring everybody up to speed. If you did not watch the BOCC meeting yesterday, we're kind of listening. We're making some adjustments to the way that the committee works. And I guess the big takeaway is that the BOCC would like to hear from this committee directly on what seems to be working, what's not working, how we could do to make things better. We've heard a number of comments from people in the committee that we want to be able to prioritize requests, that we want to take a more holistic view of the process, have a better ability to assess this funding versus all of the needs that we're hearing about from the different organizations, so that we can make effective recommendations to the Board of County Commissioners on ways to distribute these funds. So to that end, we've also heard some of those similar concerns from commissioners that, are we making sure that we're reaching the right populations, the most vulnerable groups, and so forth? And if we're doing this on a first come, first served basis, that doesn't seem to be the best way to do it. I can tell you that right now, we have received about 59 applications. I think maybe we exceeded 60 this morning. And so you haven't seen all of those yet because we're in the process of doing needs or risk assessments and summaries of the requests that we've received. So going forward, the next meeting of this group, the county commission would like to meet with the group in the same format, but we would add those 5 members to this meeting. It would be another public meeting where you can give them feedback and suggestions, and then hear from the commission about their strategic directives, the kinds of things that they want to prioritize in terms of spending, to give the group a little more guidance, help us meet the strategic goals of the commission, and more effectively distribute these funds. So that's kind of where they would like to go. I think it's in line with what the committee has expressed in terms of needs and getting more information from the commission. So I would open it up to any questions about that process, what that might look like, and then see how that guides the agenda for today's meeting. So I will open it up to the floor at this time.
Brent,
Is there room in the county,
How do I?
in the downtown for all of us to meet in
I'm
person?
sorry.
I think so.
Why not use it?
I just
I think we
prefer in person to meet somebody. But that's just my preference.
Well, the commissioners could be at up on the DS, and we can make that happen. So we can facilitate it either way. People could come to the lectern to speak or ask questions, and I think we could make that work.
Okay.
Brent, it's Melody. I'm just making sure that the mic is live. So the question that I have, and I think that's great insight on behalf of the Board of County Commissioners, on behalf of each of the commissioners, will they actually be discussing the applications with us, or more so the process? Do you know that?
I think this would be more on the process and establishing overall priorities, and then the committee from there would get back into looking at applications based on that guidance.
Okay,
That'd be like the subsequent meetings.
very good. Thank you.
Brent, do they have their plan like written down on their priorities? Could we get something to review before that next meeting of what where they're trying to go?
Yeah, there was a strategic plan developed that, based on the notice of funding opportunity, when we develop those allocations, I can get you some information on that.
Thank you.
Good morning, Brent. This is Melissa.
Melissa,
How are you?
doing well.
Good. It's good to see everybody. Thanks to you all for forwarding the applications to us for review. My guess is this is the first meeting we've attended where we're actually all fully prepared to discuss each and every one of them. Is it possible for us to do that without making a decision? Because we've noticed that as we dig into applications, we have questions. It's possible we'll need more information.
Absolutely. And I think what we'll find as we pivot a little bit in the way we're doing business in light of the new, some of the new directives, that we will be looking at more prioritizing applications in terms of ones we want to fund and ones that don't seem to meet the criteria. I don't know how much of the previous conversation you caught, Dr. Walker, but next meeting will be a joint meeting with the county commission to look at and to have a conversation between this group and the county commission on things that for you to make recommendations to them and for them to provide sort of strategic direction on the types of funding that they want to prioritize. So we have a better idea of what they want to see. Because as I mentioned, we've got more applications than we have funds for. And this would be a way to help this group prioritize and keep that in line with the commission's goals.
Yes, I understand that. I heard you say that, but I'm thinking we have an hour and a half and we have some applications and we've all reviewed them. One of the things I've noticed is as we review applications, it raises questions and helps us get some clarity on the availability of funding and what seems to fit and what where we might want more information, what we might want to set aside.
Sure. One of the things that I don't think I mentioned is that we will put a hard deadline for the receipt of applications. So one part of this process will be that applications won't continue to come in when we're ready to actually make the funding recommendations. And speaking internally with the group yesterday, we kind of thought that one way to do this might be to prioritize applications or funding requests that this group says this one's a go, this one's a no, and the others are maybes. So maybe we have 1, 2, and 3 in terms of priority rankings that the committee likes. And then at the end of the day, when all the applications are in and you're seeing it holistically, we can then make those final funding award recommendations to the county commission. So,
Grant, when you say they're redoing are they looking at redoing the budget for the different categories or leave those the same, but they want to prioritize certain groups within the budget group section?
At this point, we're working with a $13.5 million pot of money for the social service and the public health agencies. That's not to say that you couldn't go to the commission at the end of the day and say, we think we should spend more in public health than we're doing in social services. We'd like you to reallocate within the 13.5 million. Or you could say to them, we really think this needs to be 15, and they could then look at that process. The process then for them to see if there's another place that's being underutilized that they could reallocate funds. So you can make those recommendations, but right now it's within the $13.5 million allocation.
Brent, is it going to be kind of a, and I know you don't know maybe 100%, but like categories, like you sent us that chart that's got, we talked about PPE, temp facilities, disinfection. Or they might give us direction to say we want to focus on PPE and these are our priority one in these categories. And then, we debated programming a lot last week, it seemed like. So are they going to maybe I think that would help if they, just like I suggested, lumping some of those together, and maybe they'll tell us that. But if we could get it into categories, because coronavirus, obviously, at least me, think PPE and those types of things first. But I don't know if that's the categorical type thing they're thinking of.
Okay.
If that makes sense.
I hope you ask that question next Thursday morning.
Will do, Brent.
Okay.
That's a good question.
My concern continues to be, and it's Melody, my concern continues to be the amount that is actually allotted for this sector. It's a little over 13 million. And I'm looking at, in today's discussion, 2 applications that are close to 10 million. And I still would like some guidance on how we prioritize allocating those, actually lending our recommendation to the BOCC in terms of actually allocating this funding, which is for 59 organizations, is going to be woefully short. So that's something that I will bring up at the meeting on the 27th.
Very good. Yeah. I think that's the kind of feedback they want to hear.
Brent, I'd like to make a motion that we consider one by one the applications that we have before us and do it in alphabetical order, which means that Ascension via Christie would be the first application that we look at.
And I second that motion.
Okay. So we've got a motion and a second to look at the applications on the agenda today in alphabetical order. All in favor say aye.
Aye.
Aye. Any opposition? Okay,
Seeing
may I
none.
ask one question? Are we looking at them in terms, do you want to make funding award recommendations or just review the applications and prioritize them?
I use the word review on purpose, so my idea is that we would just go through the applications.
Very good.
I think it will answer a number of questions about what's in, what's out, the pots of money, because they're so representative of all these questions.
Right. Okay. Well, with that, let me give control to Hope. She will guide us through the applications.
All right. Good morning, everyone. Can you hear me well enough?
Yes.
Okay, great. Sorry, let me get readjusted here since we changed our order. So we will start with Ascension. All right. So Ascension via Christie Hospitals in Wichita. It's a public health provider who has provided services for over 4 years in Wichita. They have 5,300 employees. They have an annual budget of $1.21 billion. They have received HHS funding of $11.8 million, state assistance of $250,000, and private funding of $529,000 so far. They're requesting $8,611,162 to allow Ascension to effectively isolate patients who have tested positive for COVID-19 without the need to occupy space in other hospital units that are not designed for infectious disease control due to higher patient volumes. The method they used to determine this $8 million request was facility staff performed a review to determine the bed capacity needs and the number of negative air pressure necessary to handle a high volume of COVID-19 patients. The facility project managers worked with the contracted architects who are experienced in healthcare facility construction to estimate the cost to renovate that unit that they're requesting the funds for. The adjustment to delivery of services that they're requesting for renovation of the COVID-19 unit will be $6,624,527 for the facility alone, and then $1,986,635 for work from home / IT funding request. And when looking at the risk assessment, thus far, what they reported that no employees were laid off, they had no facility closures, and most of their employees are currently able to work from home. So with that, I would like to hear what everyone else thought about this application.
This is, Melissa, this is a really interesting application because it allows us to think about public health needs and funding them. The community would be sunk without Ascension via Christie, Wesley, and all the other clinics and hospitals in town, particularly the care that's being provided to people who have tested positive for COVID-19 and require intensive care. So one of my questions about the $6.6 million request, which appears to be a capital request, but I'm unclear about whether this is for construction, putting up shields, reconfiguring floor 8 northeast, or literally moving walls around. Are we talking about equipping this space with specialized equipment? Are we talking about intensive care? Are we talking about non-intensive care? I understand the need to isolate COVID-19 patients, but I'm unclear about what the capital needs are. I'm also unclear about whether these expenditures have already been made, whether $6.6 million has already been spent to refit this part of the hospital to care specifically for COVID-19 patients. It makes perfect sense to do this in preparation for what might come in the spring or in the winter and the spring. But I'm unsure about whether this space has already been reconfigured and equipped and they're looking for reimbursement, or whether this is something they're doing in anticipation of having to provide care in a segregated area for COVID-19 patients. And again, what kind of care are we talking about? Is it intensive care? Is it general hospital care? It doesn't appear that they're asking for staffing costs associated with this, just capital costs, but what are the capital costs specifically? I'm unclear on that. I'm also wondering why this request is in this pot. In other words, the public health and human service pot, which includes for healthcare providers $1.5 million, nowhere near the $6.6 million that's being requested. There are other places that this potentially could fit in the CARES allocation, but I need guidance from you all at the county about what those other options might be for this application.
I also have some questions. Are we also getting an application from Wesley Hospital for $8 million or somewhere near it? Do we know?
From my knowledge, we have not received one. Shannon, are you on the line?
Yeah, I'm here. I haven't seen one for them, but we do have another application from Ascension that hasn't made it through the review process. We just got it on the 17th at the end of the day.
Well, why would we have two from them?
It's just two different asks.
Okay.
Yeah, we just haven't had a chance to review that second one. But, I just thought I would at least let you guys know that. I don't know if you want to look at them together. But it's rather, let's see, I've got it pulled up here. They're asking for another 5.3 million.
Okay.
Do you know
A lot of what's
for?
on this one, it's more adjustments to services funding, PPE of $1 million, disinfection of 53,000, temporary facilities again 269. Any other emerging need, they put 3.7 million in that bucket, so a total of 5.3.
Thank you, that's helpful.
Well, I sent Brent a question yesterday that I don't know the answer to. Is hospitals do bill for all these services, so are the hospitals and the care facilities, frankly, getting reimbursed for the care they are providing to COVID patients? I'm sure there is some amount of uncompensated care, but does insurance cover so they're recouping? I just don't know the answer to that.
Insurance or whether it's public insurance or private insurance doesn't cover capital costs. So I think the reason we're not seeing staffing requests here is because they are receiving insurance payments, whether it's private insurance or public insurance for the care that's being provided. But if you need to refit a floor or a portion of a floor in a hospital, you have to have other resources available to do that.
Okay.
I'm just guessing.
Okay.
Yeah, in this second application, they talk about just the significant costs they've had to be able to position their organization to be able to treat these patients and keep their staff and visitors safe. So it seems like, something they can't pass along necessarily in a bill to insurance.
Okay.
This is Melody, and I totally ditto what Dr. Walker has mentioned, has stated very clearly that these are capital costs. And typically, the question that I would have for county staff and also for the BOCC is that what these funds are intended for is to reimburse on capital costs. I do understand that it's temporary facilities, something that they would have to build out. These facilities more than likely would be, I don't know if they would be utilized extending over the time that these CARE Act dollars are actually committed for, and that's through December 31st of 2020. And then when I look at work from home, IT is what it looks like to me, but that is staffing associated. Those are individuals that are going to be fitted with additional technology, it appears as though, to do their work at home. So another question that I have, though, is in comparison to all of the other clinics, including the hospitals that we have in the area, Sedgwick County, where does Essentia stand in terms of the number of COVID-related patients? And how has that metric appeared? What does it look like across the county with the other service providers? Those would be some questions that I would want to have answered.
Can you repeat what that first question, the question right before you asked what the metrics compared to the other hospitals were? Sorry, I missed that.
Yeah, I have to rewind it back.
Sorry.
Let me think. Well, I know I talked about the capital expense. Did you get that? The fact that, is that what the BOCC actually wants to designate these dollars for? I think that's major, that we need to be very clear as to what services. A capital expense is not, usually it's service related. However, it's usually very tangible. So I'd like to know where the BOCC stands on that. And I'd like to hear comments, if there are any, from other committee members on what we're thinking in terms of capital related cost reimbursing. And so when looking at metrics of where they stand, I think prior to that, in comparison to other facilities, I think I was talking about staffing, that 1.986635 million is staffing related. It's indirectly, because I know that it is IT, but it is staffing related. So I think that was it.
Thank you. I'm just trying to write this all down as we go.
Certainly.
Melody, this is Melissa. It'd be a good question to ask Ascension what that 1.9, almost $2 million for working at home is for, but my guess is for the administrative staff. It's probably not related to direct patient care, which requires you to actually be there.
Mm-hmm. Okay.
I will get some more clarification though, if they can provide a little bit more detail on what that ask is, that almost $2 million ask for the IT portion of it
Thank you.
as well.
And then I'd like to weigh in on capital costs. There isn't really a source of payment for capital costs when you look at how hospitals and healthcare providers are reimbursed. It's based on the unit of service that's delivered and a preset reimbursement rate for that service. So there's absolutely capital costs associated with COVID. And I personally believe that these costs are legitimate costs that CARES funding could be used for. But then comes the question, which capital costs associated with which organization? So the hospitals, the clinics, the federally qualified health centers, primary care physicians, private practitioners who are treating patients who experience COVID and need to put up shields to protect healthcare staff. How do we think about that? I'm unsure.
Appreciate the additional information. Yeah, it's an interesting query.
Well, it seems to me we have to know if Wesley is going to make another ask of this size. I mean, if they don't, fine, but if they do, it seems to me we have to split it between the two somehow.
I know that Dr. Walker, and I hear you, Jane, I agree to some extent. But back to Dr. Walker's point that which pot of funding, it's a legitimate request, but which pot of funding is best suited for this request? And I would question the $13.7 million social services public health that we're working with right now.
So Brent, can you give us some guidance on that?
On
The which pot question? Like, is this, you gave us this application to review, so you're saying that you think it fits in this category, but could it fit in another category?
Well, I don't know that we have another category that would be large enough to accommodate it. The things that that would concern me about this one with CARES funds all go around the capital expenditure realm. If this is a remodel that isn't completed by the end of the year, it kind of is, I mean, that would disqualify it there. We do not know if Wesley's going to make a similar request, but to look at I think that for this type of a request, we're probably in the right bucket. The bucket just isn't big enough to do this and some of the other things as well. Because it's clearly a public health component. I don't know of another bucket that we would have that we would, in which it would fit.
Well, there's a building retrofits leases category, but I assume that's for the county and the city, right? It's for municipal use, correct?
Right. Yeah, on that spreadsheet, everything above the municipalities line are funds that would be either internal county expenditures or they're allocated to testing, community-wide testing.
Yeah, so there's 25 million in testing and contact tracing. And speaking again for myself, that money is much needed right where it is.
You know, based on what we heard from the notice of funding opportunities and the things that what we heard from the community, this was how $99.6 million sounds like a lot of money until you start to apply it to the needs. And then it seems like not nearly enough. But I don't know of another place that to fund this money would need to come, it's going to have to come from someplace else. It's a zero-sum game with the funds. So, I mean, as we get further along, we might see that, again, that an area doesn't require the allocation that it had, but there are very few areas that even if we took all of the funds from them would be sufficient to do this.
Are they eligible for any of the Kansas money?
Yes, I mean, I think that there was, and then Lindsay can probably speak more to this than me, but they've received some federal allocations to hospitals, so there are some other funds available to them. The one thing that they know and that we know is that they can't, those monies will have been earmarked for something already. They can't use that funds.
They are serving patients from all over the state of Kansas because they bring them into those hospitals in Wichita. So it would seem to me that would be something we could find out if some of that they wouldn't be eligible for when they are treating patients from all those western Kansas counties.
Right. And we do have some metrics that we've been tracking, receiving information from the hospitals. And I think the commissioners can speak a lot to this next week, but they're on a call on a weekly basis with the major hospitals to find out about bed capacity, what the numbers are looking like in terms of COVID patients and so forth. So there's some data behind it, but one of the things that we've struggled with is how many of those patients were county residents versus across the state or the region, in terms of just knowing what the numbers look like so we know how to make some of those other responses. And I think the last time I looked, we were in the yellow. We've got yellow, green, and red indicators on the dashboards. Green means we're in good shape, yellow is cautious, and red means we've got issues. And the hospital beds had moved from green to yellow. I don't know if they've moved back to green or not at this point, but I can look that up while we're on this.
This is Melody. I'm thinking that it might be good, well, I will make the suggestion that we park decision-making for Ascension for this particular request until we receive additional information and move to the next.
That sounds fine to me. If it's possible for Hope to get more information to answer questions about what specifically they're asking for, that'd be great.
Yes, I wrote down everything that everyone had mentioned, so I will send them an email out today and then follow up with a phone call if I need to.
Thank you.
You're welcome. All right, well, are we able to move on to the next one, Brent? Or do we have to vote or anything before we do that?
Would this group like to vote on moving along, or just, if there's an objection, raise it and we're not taking necessarily a voting type action here. We're just moving to another item. So I think we can safely do that.
Okay. All right, next we'll move on to Karen Health, if I'm saying that right. So this is one that we had talked about last time, but I'll go ahead and read my summary just to kind of refresh everybody's memory. They are a not-for-profit social service provider for more than 4 years. They provide assistance to the aging population who have income at or below 150% of the federal poverty level, with assessing low-cost prescription and vision care. They work with nearly 10,000 residents each year in Sedgwick County. They currently have a contract with the Department of Aging in Sedgwick County to provide services to the aging population who qualify for their services. They have an annual budget of $686,000. Thus far, for COVID, they have received SBA loans and private funding. They are requesting $13,050 to help them facilitate working from home for their staff while providing a HIPAA secure remote teleservice model. And the goal of this move is to ensure that there's no further service disruptions, is what they wrote in their application. They have contracted with an IT provider to help them be able to move to a VIOP model. And then basically the only minor concern that I saw with this application was that they mentioned that their accounting system is manual, but they do have a financial audit that is conducted by an outside party. So that minor concern was covered by that. The group had a question at our last meeting, if they had any actual or definitive costs that they could provide, because they had mentioned in there that they had some estimated costs. And so the answer that I had received from them was that their intention was to include applicable costs incurred during the period indicated by the CARES application from March 2020 through December 2020. For this reason, some of the associated costs that are billed monthly, for example, they have purchased hotspots to provide a HIPAA secure link to the database for their staff, which requires a monthly plan, and that payment is ongoing. So they included the cost through December 2020. And when I spoke with them, they said the reason that they're doing the hotspots versus internet is because they're not able to provide internet to their employees' homes. So that's why they're providing the hotspots in place of those. So they said, again, those hotspot costs have not all been incurred yet. That's through December 2020, but they will be billed and they will be paid monthly. So he said, however, we are past the quote phase, and they do believe that they're presenting the final cost for everything. So to date, they have expended $8,708.75 for the total that they submitted for that $13,000 request. And they would like to submit reimbursement requests monthly through December 2020 for the allowable costs that are remaining, which would be $4,341.25. So with that, are there any further thoughts on the application or anything else that we would like to ask about?
This is Melody, and I'm supportive of moving this application forward. I think that was great information, very detailed, and looks like it definitely falls into the yes realm for me.
I agree.
I would say when I was speaking with the representative from this organization, that again, just as Melody had mentioned, they were very thorough and did provide a lot of detail and said they'd be willing to provide more detail if we wanted to. But the information that they gave me so far for the emerging needs that they're needing to be able to allow their employees to work from home and still follow those HIPAA regulations made me feel really comfortable after I spoke with him.
I agree with Jane and Melody. One of the concerns I have as we make decisions about funding is whether organizations like this one can sustain this cost. Can they cover this cost in 2021? Because it won't go away. Yeah. So that's another question to ask moving forward of applicants.
But the bulk of what they've spent is to actually acquire the laptop. So at least that will not be ongoing cost.
Good point. But hotspots and
right.
the
right.
cloud-based record
right.
keeping, those are ongoing costs.
Sure, I will get back with that rep and propose that question to him if they're going to be able to cover or sustain those monthly costs that they're going to incur for those hotspots.
I actually don't think that's necessary. I would make a motion that we approve this request funding currently the actual already incurred expenses and then up to a total of $13,050 by December 31st.
Second.
Okay, so we have a motion and a second to approve the application from Cairn Health Incorporated up to the maximum request, $13,050. All in favor, say aye.
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 Any opposition? Okay.
Seeing none.
Was there opposition or not?
Seeing no opposition.
Okay. Okay, so seeing none, then we will advance a recommendation for fully funding that one. Okay.
Right. All right. So we're going to move on to another one that we discussed last week, but I got feedback on. Apologize. That would be Breakthrough. Again, I'll just provide the summary again so we can refresh our memories. They are a not-for-profit social service provider. They have 26 employees, and they provide transportation services and meals to residents with mental illness who are homeless and or low income. They have provided services in Central County for over 36 years. They are managed by an 18-member board of directors. They have an annual budget of $1.6 million, and of which 36.5% of that is federal funds through block grants. They have received FEMA assistance and SBA loans thus far, and their request is for $97,637. So the group had asked me last time on this if we could get a little bit more information on the cell phones that they were wanting to provide. And so the answer was that yes, this is a pilot program. The clubhouse started conversation with T-Mobile in July about how to overcome the challenges due to COVID-19 for high-risk, often homeless individuals who have a mental illness to stay connected. T-Mobile has been working with similar clubhouses throughout the nation to address the lack of phones, which has hindered job seeking. Based upon the experience of other clubhouses, the Breakthrough Clubhouse priority will be to provide these funds to individuals who, 1, are seeking employment, and 2, experiencing extreme isolation. Once a person becomes employed and receives their first paycheck, the phone will be returned and then given to the next person on the list. So for those individuals in isolation due to health reasons, the goal is for them to stay connected to the virtual clubhouse meetings. So with that, do we have any comments or feedback on Breakthrough?
Hope, when I went through the application, I just made notes, but I'm not sure I got all the elements of this proposal. It looks like they're requesting funding for PPE and to deep clean the facilities 2 times per year, this year in 2020. And they're asking to add a driver, but I'm unclear why the driver is needed, what the driver will be doing. Have I got that right? So 16,500 of the request is associated with PPE and deep cleaning?
Yes, and from what I read in the application, the reason that they are requesting the additional driver is due to, 1, they think there's going to be an increased need for the transportation services, and 2, for social distancing requirements. It's going to allow less people onto the bus, and so that way they're going to need another driver to be able to still try and fulfill the need for those rides.
Okay, so the adjustment request is $16,500 for those 2 things.
Yes.
Okay, and then the additional services are the cell phones, which they don't currently offer to clients who experience severe mental illness and also are homeless, providing live Facebook support, and then hiring 3 staff, a full-time nurse, who I assume would be a qualified mental health professional who could work with their clients, a mental health support specialist who would do case management, and a certified peer specialist who would assist with recovery, addiction recovery. So those are all new positions to the organization, plus supplies and marketing material. And those requests total $81,190, I believe.
Yes,
Okay.
you're correct.
Okay. So I think the cell phone idea is a clever idea to pilot, to try, because when you experience psychosis or depression or a severe mental illness, you can become very isolated, and that's one of the things we're all experiencing now with COVID. I don't know if you experience a severe mental illness, if you will use a cell phone. I think but it's worth 20 cell phones to try to see how it works out.
And I think it's great that other pilot programs have been using it as well. So they're trying to get a comparison on, has this program been, I mean, at least they're not the first one starting this program.
Yeah, so to use Facebook and to use a cell phone to try and stay connected with clients who could get themselves in a whole lot of trouble really fast. Like they're vulnerable, right? They could be in danger. Makes sense to me. But hiring all these additional staff who are, I'm sure, needed appear to me to be ongoing costs, which are associated with COVID now, but what about when the virus abates? And I have the same sustainability question. If they get this $81,000, will they be able to cover these salaries in 2021 when the CARES money goes away? What's their plan?
Well, they say they already have funding dedicated for 2021 in their application.
That's true. Remind me, Jane, for what? For these positions specifically?
It's in that paragraph. It says immediate funding for this position is critical as we have dedicated funding in 2021 to continue the position. I think that's the nurse
The
that
nurse.
they're funding for in 2021. That's
The
how I
nurse-
read it.
Okay, so the nurse is connected to the cell phones and the Facebook support. So a qualified mental health professional delivers services that are specialized for people who experience severe mental illness. So that would be great. And also it's a Medicaid reimbursable service if you have a qualified mental health professional delivering it.
Well, you both are helping me work my way through it because it sounds as though, I like the concept, and it sounds as though the CARES Act has come along at a great time where it can actually help with the piloting of the program. It appears as though they've identified how they will sustain this funding in their budget. So I think that's great.
Well, it's the only mental health app we actually have
Currently. Mm-hmm.
currently. Yeah.
Kind of agree with Dr. Walker, what she said, but I guess what I would ask, and I think it's reflected somewhat in their application, is make sure they understand the sustainability concern that we have, because I don't think we do them or us any good if we do something that is not sustainable. It sounds like they've thought about that, but I don't know if you could just touch back with them just maybe one more time, make sure they understand that's a concern and that we're not doing them any good or us any good if we do anything that's non-sustainable.
Sure, I can do that. Because you're right, they did mention that for the one position, the nurse, that they have that in there, but they didn't mention that for the other position request. So I will check with them on that. Any other feedback on this application? Would we like to wait until I get the information back before we make a decision on this application?
I'm just throwing out a question, since there are immediate costs, PPE and deep cleaning costs, and the cost of the driver that are separate from these other costs that we're discussing now. Would we want to approve those costs now? Just throwing that out.
I'd be okay with that.
Mm-hmm. I am also.
So I make a motion that we provide the $16,500 for PPE and deep cleaning the facilities and to add the driver, following Kyle's earlier logic about making PPE a priority.
Mm-hmm. I'll second it.
So we have a motion and a second to approve the allocation. The application says $16,447 for personal protective equipment, increased disinfection costs, work from home, and the cell phone and continuous cleaning, continued cleaning service, adjustments to the delivery of services for Episcopal Social Services. So all in favor signify by saying aye.
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 Any opposition? Same sign.
Seeing no
Hearing none,
opposition.
we'll consider that approved.
All right. We will now move on to one of our larger applications. In terms of detail, we will move on to Goodwill. All right. So Goodwill is a not-for-profit social service provider who serves citizens by accepting public donations of goods and then reselling those goods at 18 retail stores, 7 of which are within Sedgwick County. They do this to raise revenue for workforce and community building programs and services. The 3 programs that the revenue will support is the Next Step Alliance Adult Education Program, the Workforce Development Program, and Goodwill's Contract Service Program. They have an annual budget of $18.7 million. They have 474 employees. The only funding that they have received currently is $22,000 in private funding. They are requesting a total of $2,382,114. The state mandates required the shutdown of retail stores and caused layoffs/furlough of almost 77% of their 600 plus workforce. Majority of the employees have now returned to work, but they want to be prepared for a potential second wave of COVID in the fall. They are requesting IT infrastructure funding for incurred staffing costs due to working from home due to the stay-at-home orders. And then also they have created a new position at each of their retail stores, which is called a dedicated greeter. And this person ensures that customers are wearing masks, that they're sanitizing the carts, and they are monitoring the number of customers in the store so that they can meet the social distancing requirements. So the way that the $2 million request is broken out is first on the adjustment to delivery of services. That total is $1,055,742. $13,638 of it is PPE, and $119,343 is disinfectant cost. And then $499,321 is for a temp facility. They would like to open a new location in August 2020 to provide additional spacing to adhere to the social distancing requirements. With the addition of the new location, they will provide services to only 1/2 of the pre-COVID volume. They're requesting 2 full-time instructors at $46,811 each to ease dependence on the adjacent facility and reduce the risk of class closure due to lack of instructors. $3,797 of that is work from home /IT costs, and $419,643 is for any other emerging need. The programs and initiative totals is $1,326,372, and it is all for expanding service cost. The Next Step Alliance Adult Education Program helps over 500 low-income, high-risk students work towards earning their high school diploma, received paid college opportunities, and job skill trainings for regionally in-demand careers. This program has testing centers, including one for FFA testing for aviation and drone pilots. COVID-19 forced a shutdown of in-person classes, testing, and subsequent layoffs of 3 full-time positions and 1 part-time position. Social distancing requirements is causing an immediate need for more classroom space and further technology options, as well as further instructors. Next Step students have limited access to be able to work from home on a laptop or a cell phone. So Goodwill would like to purchase 250 cellular connected mobile computers to start a computer loan program for the adult education programs that they offer. They're requesting $1,232,750 for 250 computers with 2 years of cellular service. So with that, the students will pay an upfront fee of $35 to $50 to help cover the cost of insurance on those loaned computers. Those computers will have cellular tracking and content restrictions to reduce the risk of theft and misuse. So with that, I guess a better way, since this application is larger, is maybe if we want to break it down between the 2 sections, between adjustment to delivery and then also between the program. So if anyone would like to talk about the PPE disinfectant cost or the temp facility, IT, or other emerging needs. Let's start with that section first, the adjustment to delivery or services.
I would like to make a motion, this is Melissa, that we fund the $13,638 PPE adjustment request and the $119,343 disinfection request. I want to make sure that the PPE and the disinfection is happening either in training facilities or retail stores in Sedgwick County. There's only 7 of them. 7 stores, that is. And I'm not sure about the training locations, with that caveat.
I'll second that.
Okay, so we have a motion and a second. Make sure I get the numbers right, to fund the PPE of $13,638.
Yeah, don't believe my numbers though, Brent. Believe Hope's.
Oh,
Okay,
you did good. You did good.
Okay, good.
the increased disinfection costs of $119,343. That's what I got down.
Yes.
Okay. With the, upon proof of expenditure in Sedgwick County in classroom and retail operations.
Yes.
Okay. So that's the motion. It's been seconded. All in favor signify by saying aye.
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 Aye. Opposed?
Aye.
No opposition.
I'm sorry.
I'm seeing no opposition.
Okay. So that motion passes. Hope I'll give it back to you.
Thank you.
Mhm.
Okay. So a question that Shannon and I had kind of tossed back and forth when she was looking over my summaries was the $419,643 for the any other emerging needs. I wasn't able to 100% get from the application what those dollars would be applied for. Did anyone else get
No.
that? Okay. So my thought was that I was going to reach out to Goodwill and get further clarification on what those funds, why they're requesting that amount for those funds.
Well, we really don't have much detail on the temporary facilities. Is that for 4 months? Is it for a year? What is it for?
I'm also unclear why they need temporary facilities. I understand that another part of Goodwill's mission is to do training. That's what the Next Step programs are about. That leads to employment and supports employment. And I understand the physical distancing requirements have kind of hamstrung delivery of classes. But taking on a temporary facility is a big cost. And even if they use CARES funding this year, so they're talking about $500,000, right? Can they come up with that money in 2021 if the virus is still around? And why exactly do they need that? Could they partner with WSU Tech or use WSU facilities or some other facilities to support their training needs? I don't know.
I guess my concern with them too, along the same line, is everything, a lot of, in their application was prospective. You know, what if we get a second wave? What if things don't abate? We need to do this, we need to do that. And that's great that they're planning ahead. And maybe the commission can clear this up, but I guess I would think we'd be better off focusing, like we did earlier, on stuff that's already happened, PPEs, disinfected, costs that we know we have already incurred to work it remotely, and maybe not get in the business of prospectively trying to allocate funding, because that's a slippery slope.
Well, not only a slippery slope, but we're supposed to be responding to immediate needs with the CARES funds. So it's things they've done to respond, not necessarily. We know we had an outbreak. We don't know that we're going to have another one. So we're not spending money in anticipation. Trying to say this to follow the guidance, but we're not spending money on guesses of future things. It's more what has already happened or responding to the current need.
And I think with also in conjunction with they're wanting to do this computer program. So that's going to help when students can't come into the classroom. Could they maybe start up with that pilot program and use that? Do they really need to have a temporary facility as well as the computer program? Like, which one would be a higher priority? To me, I would see if there's another major outbreak, the computers would probably be a higher priority, but I could be wrong. But I think further clarification on that could help us with our decision.
That's a good point, Hope. And it also depends on the capability of the student, right? Does the student need assistance to engage with the laptop? In which case the classroom might be more important, but that's on them to articulate that need.
This is Kyle. I agree with Mark's comments. Did I miss, what's the 3,700 they want for work from home? Like, is that number 3797?
Yeah, I'm not sure if they provided detail on that. Let me see.
They did.
Did someone say they did?
No, I don't think they did.
Oh, okay. I didn't see it either, so I just wanted to double check. Would you like me to get further clarification on that?
I think so. It's just a weirdly small amount. They talked about computers and cell phones and some of those future expensive costs. To me, I wish we had some more info because I think it's one we could have approved with PPE, disinfectant stuff, but there's no info on it.
Sure, I'll get some more on that. Okay, would we like to discuss the programs and initiative requests that they had for the $1.3 million for the laptops?
Well, they need to go back and redo their math. The math is all off. $35 a month times 12 months is not $2,100. It's $420. So they're off by a factor of 400%. It just doesn't add. Sorry, kind of basic.
Oh, that's okay.
Yeah.
I noticed the same thing.
Yeah, and additionally, though, with that request, it is over a course of years and
That's right.
2 years of service.
Well, and the staffing is for the school year,
Yeah.
not through December. So we don't know that they can keep those people beyond this year. What they've asked for is for the school year.
So I'll clarify that we need the costs that are just going to be expended through December 2020, and then are they going to be able to sustain those costs in 2021?
Yeah.
Mhm.
Okay, does anyone else have any comments on this one? If not, I think we should table this application until I can get further information from Goodwill.
Okay.
Any objection? Okay. All right, now we will move on to Holy Family Medical. So again, this was an application that we had briefly discussed last week, but there was additional questions. Again, they are a not-for-profit healthcare provider. They are requesting adjustments due to the delivery of services where they will need additional PPE, disinfectant costs, and cleaners, and it will assist with additional staff at the door and the ability to hand out masks. They've been in the industry for less than 4 years. They have a $2.4 million annual budget. They have only received SBA loans in terms of funding thus far. They're requesting $9,680, $5,000 of which is for the diabetes program that they're starting in September 2020. So the concerns that the group, or the questions that this group had last time, was about the diabetes program. One, if it was, because it seems to cover more than just Sedgwick County. And then 2, was this a program that they had in their budget prior to COVID hitting? So I reached out to my contact, and Brenda said that they have little to no patients that would qualify for the diabetes program outside of Sedgwick County. She said, therefore, I would currently consider it to be 100% Sedgwick County. And the question that I asked, she said that to her best of her recollection is that this was a program that was going to be started prior to COVID, that they had plans to do that. But while some types of education classes are being canceled due to COVID, they are staying with the plan to introduce this program. And she said, therefore, it was more of a statement that we were continuing to move forward and offering our current services and expanding them during these uncertain times.
I don't think that qualifies.
I don't think so either. And at the risk of Jane busting me for adding wrong, I'd like to make a motion that we approve the total $4,680 request. So $1,345 for PPE and $3,335 for disinfectant.
We actually did that last week.
Yeah.
Did we? Okay.
Right.
Yeah, yes.
So that was brilliant. We're done. Next.
We're moving right along.
So are we denying the diabetes program? Okay.
Yeah.
Yes.
Save from the embarrassment of Jane double checking my math.
I'm getting a terrible reputation. They put an account on here for one reason.
I like that you do that. That's good.
Okay, with that, we will go ahead and move on to Humankind Ministries. Okay, they are a social service provider who provide shelter and assistance programs to the homeless citizens of Sedgwick County. They have provided services for over 4 years, but their name has changed over the years. It just recently changed in 2019. They have an annual budget of $1.5 million. They have a staff of 23 employees. They have received $172,000 in SBA loans, $71,000 in other federal grants, and $59,000 in other funding, and then $6,270 in private funding. So they're requesting a total of $393,721. It is broken out by this. There's $348,000 is for other emerging needs, $20,000 in temporary facility needs, $19,089 in PPE costs, $4,568 in disinfectant costs, and $1,827 in IT/work from home costs. So their application stated that people experiencing homelessness are at a greater risk of exposure and may be more vulnerable to the effects of COVID-19 simply due to being homeless. Many different groups, such as homeless families with children, persons with long histories of homelessness and high rates of disease/poor health, and still others with full range of behavioral health issues, make them extremely vulnerable to contracting COVID-19 and spreading it. The basic medical advice to stay at home if you are feeling ill simply cannot be applied by those who lack a home to stay at home. The largest portion of the funds will be used to open a third location in October 2020 called the Emergency Winter Shelter that will follow COVID-19 social distancing regulations. The building they will use is currently empty on North Broadway and will be used as an overflow shelter for the emergency shelter, which will allow Humankind to maintain safe and socially distant sleeping arrangements for the clients and provide access to the building outside of sleeping times to lower the spread to the general public and/or among each other. They are the only no barrier emergency shelter in Sedgwick County for men and women. They will also use the funds for PPE, staffing, and towards increased cost of citizen intake, such as they are now doing temperature readings on intake, well-being checks, and required hand washing upon entry. Funds will also be used towards Operation Holiday, which is Sedgwick County's largest holiday assistance program. It is a program that is held in December which provides food, winter clothes, etc. to over 10,000 low-income families. Corporate donations have been on the decline due to COVID. Thus far, they have declined $25,000, and they're expecting even more declines. They're expecting a 10% increase in participants. So there's a decline in donations and then an incline in participants. So to allow for social distance practices, they have restructured their entire distribution plan, adding extra days and times for pickup, as well as changes in donations and creating a drive-through for safe practicing pickup. The funds will also be used for the Humankind Villas, which provide housing to 112 residents, and they also provide rent subsidies to the homeless and low-income families. Without getting some CARES funds, they state that they will be forced to begin evictions. And since March, they have lost over $20,000 in rental income from residents who can no longer make their rent. And with that, I will leave it open to the group.
This is a hard one, I thought.
I think the PPE and disinfectant costs, that's an easy one to talk about.
Right.
But I think there's a lot of moving parts to this application in terms that they have, they need a facility. They also offer these programs, and then they also have these apartments/villas for the homeless to stay in as well, or low income.
This is, Melissa, maybe one way to think about this is what the immediate need is and what will keep people who are homeless safe and COVID-19 negative, not positive. The emergency winter shelter is run by Humankind Ministry, so it's available for both men and women, and it's a place where people can stay overnight and get a warm meal. This agency depended upon volunteers to cook those meals, to serve them, to provide support to the emergency winter shelter. And now, because of COVID, it's all being delivered by the staff people of the agency. Winter is a time when people who are homeless are most vulnerable. So it's important for them to have a safe and warm place to be and to get at least one meal each day. So the request that's associated with the emergency winter shelter and with opening a building that's now empty, Safe Haven, so that they can physically distance the scores of people who use the emergency shelter during the winter months makes sense. But during the winter months is the important point here. So this funding ends on December 31st. And I'm not exactly sure when the emergency shelter opens. So that's one of my questions.
I think it's at October 2020.
So I think the part of the request for October, November, and December is legitimate and falls under CARES. But this funding cannot be used in 2021 when the winter shelter, the emergency winter shelter, continues operation. And I agree with you, Hope, about the PPE and disinfection costs. That makes sense to me. I think providing funding for the temporary facility for Safe Haven, but then that has to be prorated too. $20,000 is, I assume, looking at the whole time the emergency winter shelter is open, but it's only until December 31st that the funding would be available. Rent subsidies, I would set those aside. I understand that they're needed, but, or if we do take them up, then they would only be for 2020. They would end on December 31st.
So Dr.
I've actually worked at that overflow shelter on a couple of occasions, and there isn't near enough space. I mean, they're going to have to do another. I mean, you got cots right beside each other in that facility. I'm surprised they don't need food assistance, but they didn't ask for it, because why I was there is we were donating the food for that week. So I'm surprised they didn't make an ask there, but they didn't. So, but I agree with the shelter at least through December, and the disinfectant and the PPE.
So I have a question about the any other emerging needs. Dr. Walker, are you saying that we should prorate that for the through the period of December 31st, 2020?
Yes.
Okay. Yeah. What I would like is for that to be, and it is, but this is in a narrative form. I would like for it to be actually itemized where I can see those costs and I can attribute the proration. That I think that would be great. And yes, I would be supportive.
Okay, I agree. They need more detail.
One thing I wanted to point out, and they mention it on page 4 of their application, and I'm not that familiar with it, but I know the city passed through some ESG funding to them, and I see they list some HUD funding. I would just want to make sure that we're not duplicating any extra funding that they've gotten through CDBG or CSBG or anything like that, because that would maybe be kind of embarrassing for us and for them.
Okay.
I don't think that the HUD money, which is emergency shelter grant fundings, they're the same thing. That federal money that they receive is for the emergency shelter, but that's a good question for Hope to ask.
I will double check on that.
The emergency winter shelter, I mean.
And is there anything else that stuck out to anyone or you would like me to follow up on? I think with that, did we talk about approving the PPE and disinfectant costs?
Yes. Yes, I think we did. You might want to.
I guess what I have heard at this point is general support for the PPE and disinfecting costs, and then some support for the temporary facilities for the
For 3 months,
program.
right.
So, but I don't know that we've got a number for that. So I guess I'll entertain a motion if that's the will. Probably a motion for PPE and disinfection costs.
I'll move to make that motion.
Second.
Okay. So we've got a motion and a second to approve the request for PPE and for the increased disinfection costs. And that would total $23,658.08. All in favor signify by saying aye.
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 Aye. Any opposition?
Not seeing any opposition.
So that motion passes.
I would like to point out that it is 11:30 and we are only scheduled to go till 11:30. So in the interest of our YouTube Live and Facebook Live folks, we should probably consider closing out the meeting.
So before we do that, maybe we could kind of summarize what we've learned so far from these conversations going through applications. We've been zeroing in on immediate needs, so PPE, disinfecting. We've been looking at direct costs associated with COVID-19 and addressing the issues for these agencies that COVID-19 raises. we're unsure about capital costs and how to think about them. And so far, we've been reluctant to think about new costs. We have questions about their sustainability. Can the organizations continue to cover these costs in 2021 and beyond? See, we have learned a few things.
While we were on the call, Lindsay's forwarded some guidance that we received earlier on the capital expenditures. And I will briefly summarize what we've got, and then I'll just provide this information to you. But it wasn't the last email I got, imagine. Basically, there's some concerns with the capital cost under the federal uniform guidance. One is that those CARES funds have to be used to address necessary expenses related to the current outbreak, not a future. That CARES funds may only be used on capital improvement where we can improve. There's no other available space for lease in the short term, like a hotel, former hospital, or other space. We don't know that cost analysis has occurred. And again, December 30th deadline. So I'll forward this information to everybody. And then there's some more information about some other funds from the federal government that Ascension and Wesley have received. So that'll kind of give us a little bit more big picture as we look at these. Yes, to summarize where we are at this point, there were 4 recommended approvals today. Goodwill Industries, Episcopal Social Services, Breakthrough, Cairn, and Humankind. The total of those is $186,136.08. So with that and the previous recommendations, we would have a remaining balance of $13,252,768 and 32 cents. Jane, please check my math.
I don't have my calculator with me,
Okay.
but I will.
There anything else to come before the board today?
So Brent, earlier you talked about next week, the joint meeting. Is the preferred meet in person there or what?
We can accommodate, I think we can set the room up. I'll have to check on the availability of microphones for other than the ones at the commission chamber. I think we can have, I know of 3 or 4. So we could probably accommodate the group in terms of spacing. If you want to come in, feel free to plan to do that on the 3rd floor of the courthouse, the commission chamber. If you want to join this way, there will be that Zoom invitation available as well. So I think that's your preference.
Great, thank you.
You bet.
All
So
right.
will you be sending more applications this week, Aaron?
Yes, I will be sending more Friday afternoon.
Okay, thank you.
Shannon has actually already prepared a number of them, but I wasn't sure exactly how far we would get into this meeting, so I didn't send any more along last night. So,
Okay.
But there will be plenty more on Friday. And if there's nothing else, I'm going to go ahead and shut down the meeting.
Thank you.
Thank you all.
Thank you.
Thank you.
Thank you.
Thanks. Bye.
You too, Melody.